Come on, baby, just come on, baby. Come on, baby, just baby, just come on, baby, just
So what have you been up to, man?
Working. I'm actually in the process of helping a lady who has Lou Gehrig's disease. She has ALS. She's paralyzed from her arms down. I'm helping her move. I've moved her into an apartment close by. I'm taking on full-time caregiving for her, actually.
Okay.
Other than that, sorry, shot went really wrong last week, so it was a little bit of a problem. I'm apprehensive about getting my my injection this week.
Let's talk about that, because a lot of people don't know that trans men have to do HRT, which is testosterone, and there are different levels of testosterone that we take. There's the patch, the patch, the gel, the androgel, and the shots. And
Yes.
I'm allergic to the generic testosterone, which is cyponate. Is that what it is?
Cyponate?
Yeah, I have to take that more expensive, the Etherland, or whatever the frick you say it. I can't even say it. And the funny thing with that is that we all get anxiety when we have to stick ourselves. You know, it's amazing.
I cannot stab myself. I have to have somebody else do it. I can't do it. I can't do it. But yeah, here we go. Let's do it this way. Here we have a nice little box.
Right. My box was in here somewhere.
Testosterone cypionate, that's 200 milligrams per milliliter.
Right.
23 gauge injection needles, 18 gauge drawing needles. And yeah, if any trans guys have any questions about how to do their shots, the dangers, anything along those lines as far as intramuscularly go, I've been doing them since 2014, you guys. I got you. But yeah,
well, you know, I do mine. I actually do mine in the shoulder, the thighs, and I used to do them behind my leg. And I used to do them when I got fat, skinny. When I was skinny like you, I could get behind my back here, but I can't stretch like I used to. So right now it's in the thighs and the shoulders, and I do it actually every other week. It's like that. It's my whole setup. You know, and I do that. But you know, it's funny because when I have to do my shot, it is so crazy because it's like doing an exercise. You know how you prep up to go jog? It feels like you getting yourself set up to do it. You're like, okay, I got to do this. I got to do that. And it's like when someone else gives you the shot, it's like, okay, thank you. All right, bye. But when you give yourself the shot, it's like you do all this stretching first and you do like this first. It's like you get ready to jog across a damn track. You got all this going on to do it.
I have a routine I have to go through, and if I don't do my routine, I can't. Hey, Ari. Hey, Ash. Hey, you guys. Hey, Amanda. My little sister's tuning in too. The girlfriend's tuning in. Hey, baby. Paige, get off the chat. But no, I'll put it like this. I'll draw up my shot, and it usually has 45 minutes to an hour of shelf life.
Right.
Within that hour of time, you have time to inject or after. But I will sit here and this is going to sound really bad, but y'all know, self-medicate. I have to, because my anxiety is so bad because of needles. It's horrible. I refuse. I cannot. It's not happening.
Well, see, a lot of guys don't understand that a lot of guys get the higher gauge and lower gauge, one for drawing out and one for giving. I've never done that. I just use, I think it's a 22 or 23, and boom, I'm good.
See, a 23 gauge is what I use to inject with, but the 18 gauge is what I use to draw with because it's easier. It's really quickly. And I've had too many accidents happen from trying to use the same needle to draw up my shot and inject with. It's
wow.
I actually I'm not going to show my butt on live, but there's a knot right now from last week me trying to do that. it knotted under the skin really bad and caused my blood pressure. That's why I had that blood pressure spike really bad last week.
Yeah, because you got to be careful with that. And another thing a lot of brothers don't know, and a lot of people don't know this, before you do your testosterone, watch what you eat prior to. Watch what you eat prior to, and make sure you have enough fluid in your body.
No energy drinks, you guys, right beforehand, because if you drink any type of Monsters, Red Bull, anything within the first 3 hours of getting your shot, oh my gosh. You're going to be angry, you're going to be groggy, you're going to want to lay down, but at the same time, you're going to have enough energy to where you're not going to be able to, and it causes a lot of issues. Other than that, I will tell you guys out there, I'm not going to lie to you guys.
Drink a lot of water prior to your shot. And that's another thing. When you're on testosterone, you need to constantly drink water. Fluid. Not soda, not coffee, not milk. Water. You need that because it's going to help flush out that liver. Because people don't understand, our liver actually is a filter. And it will affect us as well. When I started my transition, I was told to stop drinking, stop doing coffee, stop drinking cocktails, because that medicine was going in my body. And to be honest with you, I'm glad I did, because as soon as I started my tea, my body was clean of toxins and medicines and all that, that my testosterone kicked in 3 weeks, 3 months. Yep. 3 months time, I began having facial hair. Where most people are waiting for facial, I was like, boom, facial hair. I couldn't keep the hair off my face. And I still can't keep it.
That was a difference with my specific deal with me being intersex. With the way I was growing facial hair already. That wasn't an issue for me. I was already growing facial hair. It's this that's starting to come in.
Yeah.
That's about it. But I will tell all the guys out there that are coming into this and just starting their transition. If you have shot anxiety, it doesn't get easier, you guys. You just learn how to deal with it. You learn that's...
Yeah, because, I mean, I'm older than you, and I still got anxiety. I'm like, here we go. I've learned a technique. I've learned to use a technique to do it, but it's just been, I had to learn that technique for myself to give a shot, and I was like, okay, here we go. Breathe in. All right, breathe out. Here you go. You're done. Okay. But it just... At my age, it's been like that for years. I mean, I've had it for years too. And the thing is, a lot of it is we see it where it's going and we feel it before it gets there. So that's a lot of things. But when somebody else gives you the shot, it's like you don't even feel it. It's amazing how you don't even feel it when someone else gives you the shot.
I can't inject myself. I can't do it. I've tried. I really can't. Like, I have a atrophied muscle in my right leg right here. The main tendon that goes across your kneecap and hooks to your hip, mine is atrophied up from the military. So it's literally in a ball right here on the side of my thigh. So I can't do thigh injections, which is one of the main ways trans guys can. I can't inject myself at all. It's no. Mm-mm.
Have you ever tried your shoulders?
I use my arms too much. It stays too sore. I can't because it's too sore. That soreness drives me crazy over the next 3 to 4 days, and by the time it eases off, it's shot day again.
That's why I do like 1, 2, 3, 4, 5. 1, 2, 3. That's how I do it. That way I'm not going through it. That's the best way to do that. But yeah, for those that don't understand, the testosterone shot, you all have no idea what we go through for the hair. You know, Jaden, when it comes to the hair, facial hair growing in, like Adam was saying, because he was intersex, he had more facial hair that grew in for him. I'm intersex, but mine was already up here. I was already shaving when I was living female. I was shaving here. It depends on how you're taking your shots, depend on your dosage, depends on how you're taking care of your body as well. If you don't smoke, don't do drugs, and you're doing nothing but healthy eating, like I end up doing, I cleansed my body and did nothing but healthy eating and healthy drinks and all that. And I mean, I still live that way. I cheat sometimes now, but yeah.
This right here slows down your changes.
Yes, it
will
does.
slow them down, and it slows down.
It's a drug. Nicotine is a drug. Anything that's a drug against a drug, it'll enable it to do what it needs to do. So Jaden, it depends on a lot, even your genetics as well. I tell anybody, if you can purify the body, check it out, see what happens, and take it from there.
Another thing too, on Jaden, Jaden, another thing too, I will tell you that was some of the best advice because mine wouldn't connect, as you see. It thickened up. Here's some great advice I can give you that I've been given by a couple other trans guys. Go get some biotin. You can buy it over the counter. It's a natural supplement. It helps with hair, nail growth, and it will help it fill out some. It's not going to work wonders, but it'll help add to it.
Right. And if you're not a naturalist like I am when I started my day, yeah, go get the biotin. But I eat so much healthy food, and Brandon lives here with me, he does too, that I don't need the biotin. The only thing I take is niacin, a few other things, and that's it.
See, I can't take niacin. It makes me feel like
Right.
my whole body's on fire.
Yeah, a lot of people can't take niacin. A lot of people can't do niacin. So it depends on the individual. It really depends on the individual.
The other thing I've found that tends to help is you have to be careful with them, but the testosterone boosters from like 6-Star Elite, the muscle building company, the testosterone boosters through them, they don't affect your T levels too much, but they do help enhance the growth and the changes.
They do. They do. You just have to be careful with them and how often you take it.
I'm a firm believer in whey protein and working out, and protein is where it's at, you guys. I'm trying to tell you, it helps with the soreness.
Well, the reason all that helps, and I'm gonna tell you why, is because we come from frail bone bodies. Being female body, we have, when we come from female body, you have frail bones, and because of that, your muscles begin to grow around those bones. So you've got to strengthen yourself and your bones your body. Everything's got to strengthen itself. So working out helps you stretch those muscles so that the oxygen can go through the blood system and all that. Also remember that exercising, eating healthy helps fight against high cholesterol, diabetes, high blood pressure, blood clots that we can accommodate, as well as cancer from testosterone as well. So we are at a high risk like trans women are, but we're at a higher risk. So we have to really take care of our bodies at best.
Watch your blood pressure, man. Watch the blood pressure. That's one thing I will tell everybody. I am 31 years old. I am 5'7", less than 150 pounds. I work out daily, and I still have to worry about blood pressure issues. I was a perfect candidate to start off with. Now, I didn't have high blood pressure, but testosterone causes it. It will cause issues completely. It will cause you to have heart issues. Don't overstress. Guys, please take my advice and don't overstress, because it will cause you to have a heart attack.
Learn to meditate. If you got trauma in your life, kick it to the curb. I'm telling you. That's what somebody told me when I started years ago. They said, Flex, you about to do the HRT. I'm telling you right now, stress-free your life. I said, well, how you do that? They said, get rid of everything that's drama. I said, okay. And I got rid of everything that was drama. And that's why I don't deal with drama. I don't deal with stress. Because I know it's going to kick something. As old as I am, I'm not trying to kill myself.
Hey, Landon, I hope you're healing from top surgery well, bro. He just had his top surgery last week. So congrats,
all right,
Landon.
with the top surgery. I was glad when I had my top surgery. I was excited. I was ecstatic. I was like, you couldn't tell me shit.
I'm still waiting, man.
It's okay, man. Look, I'll show my chest for you. If you can't show your chest.
Show it off, Flex.
Look, take me to the pool. I splash it like a big old black chocolate whale. You ever seen a black guppy? That's me in the water. Look, let me tell you, when I first went back to the don't be scared, Landon. Just go to sleep. Let them do their thing. Don't fight.
He already did. He's still dealing with the drains and everything. I was talking to him. He was on live yesterday. He's got a hematoma. And I'm hoping healing's going well, though, bro. I really am.
Well, I'll tell you, Landon, when my mom asked me, she said, well, how do you feel? I said, I'm at peace. The top surgery I had been waiting for a long time. And many of you that know me on here, AJ knows me, Brandon, when I had my top surgery, you couldn't tell me nothing. I was just like, it's done. I'm a happy camper, and this is what's going to be. It is what it is. I'm loving it. Y'all see me? I'm wearing my little, because it's a little chilly with the air conditioning. I'm a little sexy right now. That's what I'm trying to keep. At my age, I'm trying to bring back sexy. That's all I'm going to say.
Hey, I'm trying to bring it back too. It's too bad all this.
It's all right. It's all right. It will happen. You know, I got frustrated for a long time when I started seeing my brothers having surgeries before me. But I had to understand that everything happens in the right time when it's supposed to happen. Everything happens for a reason at the right time it's supposed to happen. It's frustrating because we deal with the dysphoria of having the man boobs, and it's just, you know, it's very frustrating. Very frustrating.
You know what, Flex? I'm actually going to request that you take me off air. I want you to bring Landon on. I actually would love for him to talk and speak on his journey.
Okay.
I know his sister personally, and I know him. I've known them since before he started his transition, and he's a great guy. I fully vouch for him.
Okay.
He's an amazing guy.
Okay.
But I'll
So
be here, you
Landon, would
guys.
you like right, Landon, do you want to come on live? If so, just put let me know you want to come on live and we'll bring in. I'll take you off and bring Landon in real quick.
All right, man. I'll see y'all later.
Thanks, Adam. All right, Adam. See, it's that easy. We're talking about our experiences. We want you all to learn from them and grow with us through them. Now, let me make sure I'm doing this right. Because, you know, sometimes I don't think he's here. Well, Landon, send me an invite, or maybe I can't read. No, I don't see it there. Okay. Landon, if you can, send me your invite. Okay. Okay. You're with your twin. Okay, I understand. Well, when you can, Landon, let's do so. Is there another brother that likes to come on? Oh, wait a minute. Somebody's giving us a red light on that. There we go. Here we go. Here we go now. Here we go. Here we go. All right, Landon. Okay. Awesome. 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 Awesome.
Hey, I'm
Yay!
Landon. This is my twin sister Zena.
She look like me. That don't look like you.
We're identical twins.
Oh, I thought she was my identical twin.
That's
So
my
how's
twin
your
sister
journey,
Zena.
brother? How you doing?
Oh, I'm in pain. I'm having issues with my drains at the moment. There's actually a blood clot that won't like come out of it.
Mm.
So I'm trying to like rest all I can.
Are you drinking a lot of water?
I am drinking so much water.
Are you drinking any? Did you take any vitamin C?
No, I actually went for a walk though to try and like get the blood circulating, and because he told me to, you know, stay propped up and walk and get, you know, do everything I can to walk around. And I've been doing it, but I guess I have low iron too, so that really probably doesn't help. And what I was saying earlier was my blood pressure dropped in surgery, so when that happened, uh, you know, it scared them really, really bad because they almost had to give me a blood transfusion.
Okay.
So they
Did,
were freaking out.
what I was going to ask you is, have you asked your doctor, can you do vitamin C?
I haven't asked him. I'm supposed to go see the doctor on Wednesday. So hopefully I can talk to him and see what else, you know, he would want me to do.
Yeah, because you could do vitamin C if you can. That's going to help a lot.
I just know, like, you know, it hurts really bad. And
Are you doing anything, rubbing anything around for bruising? Anything on your?
No, I actually, like, you can probably, they won't let me do anything till, but I know you can probably see this right here.
Yeah.
Like, I have it all the way down on my left side. Like, my whole side is like that.
From the surgery?
Yes. I'm completely bruised. I had a huge, like...
It was the size of a double D breast.
As my twin sister calls it, it was the size of a double D breast.
What size
like, this is
were
the
you?
first day.
So what size were you before?
I was, okay, before, like, hormones and everything, I was a double D. Completely. Then I started hormones, and it dropped all the way down to a B cup.
A cup.
No, it was B cup up.
Oh, yeah, B cup.
twin sister.
So,
I have-
so you were actually big in the chest area.
Yes, I was freaking huge. Freaking huge.
Holy
But
Toledo!
then my hormones, you know, made it drop down. And when my
changed.
hormones made it drop, everything started changing.
Right.
Because I've always been a very athletic person. So, like, you know, I balanced myself out pretty well.
Military school.
Okay.
Yeah, I was in military school. So, like, I was pretty fit.
Okay.
And then, you know, with the hormones started hitting, you know, my weight started fluctuating, dropping, gaining, dropping, gaining, dropping. And then my mental just completely changed. And then, of course, when you're, you know, you get aggressive. And then the depression is real for trans men a lot, too.
Right.
Not saying it's not everyone. Everyone else has it, too. But, like, it's more heightened sometimes. So when it got heightened, you know, I wasn't eating because I wasn't hungry. And then I had a hysterectomy as well.
Okay.
So when I had a hysterectomy, of course, you know, all of the emotions was like, basically, what the hell is going on?
Right. Right. Right.
I was on hormones. I had a hysterectomy. I had the hysterectomy first before top surgery. I had the hysterectomy 2 days before my 1 year on hormones.
Okay. Okay.
One big ball of emotions.
Well, I'm going to send you positive energy of healing because you're going through a lot of complications right now, and some of us didn't. I mean, I thought I was going to go through more than anybody because I was older. I was like, I'm going to go to sleep and not wake up because I'm old on the table. And I came out like a fish that just jumped in the water and jumped right out of water. So we're going to all send you positive energy right now because what you're going
I need all of
through.
it.
Yeah. Where are you located? What state are you in?
I live in Atlanta. Well, not Atlanta. Gwinnett County. 30 minutes from Atlanta.
Okay. Well, I'm going to send you positive energy. And if there's anything you need, let me know. Because I know you're going through it. For the top surgery, some people have it easy.
Yeah, my twin sister's like, what can I do to help you? I'm like, there's nothing really you can do. My body just has to heal properly. And it's really difficult because, like I said, you know, I was healthy. I was fine. And then I just recently found out, you know, because my daughter is so watches out. I was passing out at work, having heart flutters. And I've never had that before in my whole life, like ever. And she looked at my levels and she was like, you know, your thyroid level's really, really high.
Wow.
So the week probably before surgery, she ordered some more tests and she called me and she was like, yeah, we need to get you in a thyroid specialist so we can, you know, do an ultrasound of your thyroid and put you on thyroid medicine, on thyroid meds, because I'm hyperthyroid.
Wow.
But you can ask my twin sister, I don't believe in pharmaceuticals at all. I don't
either.
I don't agree with them because just I have a lot of behind it why I don't like them. But one of the reasons is because they hurt you more than they help you. So I'm not about that at all.
Well,
so
I'm about to send you a list of Chinese and Oriental teas because that's what I do, and I'll send them to you privately, and so that you start drinking those teas because I don't. You know, anybody that knows me, aspirin, what's that? Just give me some ginger. I'm good.
Good thing I'm allergic to it.
Yeah, you know.
Because I don't take it.
Yeah, so, and I was lucky with my top surgeon. My top surgeon was like, he's a very much naturalist. So he was asking me a lot of questions about what I eat. And so he was like, you'll be fine. He said, you'll be fine. I just didn't like the idea that I keloid, but that comes natural with dark tone melatonin. But I still feel sexy, so, you know.
Yeah, you look good though, boo. You look good.
But you'll be all right.
I mean, it doesn't, like, my sister will try and show you. The bruising is like, I can't lift my shirt the whole way up because I'm still sore.
Right.
But it's all like black and blue all the way down.
Hold on.
Let me turn on the light.
Yeah, he's turning on the light.
You can say hello, Zena.
Here.
But I have bruising all. Let me try and get my shirt off.
Landon, no. You do not listen. Good God.
Okay, so this is where the This is where it was.
Right.
The hematoma. It was literally a double D
Wow.
of like blood, and he kept me awake to get
drain
it out, to drain it. It was awful, and then I still have some bruising. Literally my left side is covered in bruising.
Tell them they did your bandage too.
And they actually
They taped
my bandage so tight, like I guess so I wouldn't touch it.
Yeah.
But they taped it with medical tape so that I would not fidget with it, I guess, to, you know. But it's the whole left side is covered in bruises.
So what
the
type of
worst.
what kind of surgery did they do? Did they do the T surgery, or the incision?
I went through the keyhole, which is a little slit in your nipple. Yeah. They went through keyhole and ran into complications.
For a double D?
Yeah. Well, my test had dropped to a B, so he said he could handle it. So when he did, this is my outcome now. This is what I'm dealing with. Yeah, my doctor, yeah. Needless to say, I was just like, okay, well, I think you pretty much screwed me up, but
your nipples still look good.
my nipples look great, though. Like, I saw my nipple, like, I can see this one because it's not black and blue. But this one looks pretty great, except the drains right here.
Did they skin graft the nipples on you, or they just moved them up?
They just moved them up.
Okay.
So
I looked at my nipple and looked at yours.
yeah, my twin sister looked at her nipple and then looked at mine, and I was like, Zena, it's not gonna look the same anymore. Because growing up identical, most people, when I say identical, they look at me funny, and I'm just like, yeah, I think we're a couple, and I'm like, my twin sister's married, and when you try to explain, they, people say the most off the wall things, like, well, why does he have kids?
Why is she a lesbian?
Why is she a lesbian? And I'm like, look, we don't need to get all in that. It's none of your business.
That's Georgia for you.
Yeah, Georgia.
But the funny thing is, they look at your sister and they look at you and they're like, okay, she's a lesbian, and you're probably a little redneck white boy in the South, so
That's pretty much how they see it.
Surprise,
like,
y'all.
They look at us and they're like, okay, well, something's wrong with you. And I'm like, well, nothing's wrong with me. I'm just different.
Well, now you're gonna be really confusing people.
Yeah. I'm totally not mad about it. Like, I asked my twin sister, I was like, how do you feel about it? And she was like, I always knew. Like, I'm glad she knew. But she was like, the only thing that made her sad was, you can see, like, now, like, after being on hormones for 1.5 years, like, we're starting to look different.
Right.
So it makes her sad. And she's like, we're twins, damn it. And I'm like, I know. Well, I really can't help it,
So let me ask
and
you a
I wouldn't
question.
do my hair purple.
Let me ask you a question. Because you were identical, are you beginning to look more like your mother or your father with the testosterone?
Neither.
I look like neither one of mine. Neither one.
Wow.
Yeah, I thought that I would look like my real parents, but my real parents, I look nothing like them. I thought I would look like my father on hormones. Thank God I don't. Thank God.
Wow, because I look like my dad. I look just like my dad.
Yeah, I look like neither one.
Wow. That's
So
crazy.
it's pretty good.
Look at Minnie. Hurry. Look at Minnie.
This is my sister's wife.
Hello. Well, it's good that you have the support that you have, because sometimes we don't have the support as trans men.
They're the only ones I have, like blood family. They're the only ones I have. My father is a preacher. My mother is a preacher's, wife. We are preacher's kids.
Wow.
So, yeah, we were raised independent fundamentalist Baptist. So we had to wear skirts and dresses 24/7, be at church 24/7. So when my parents actually found out about my top surgery and told me that they basically to fuck off, excuse me, but that's basically what they said. They didn't want me to come see them, talk to them, anything. because I am, according to them, I am everything that God didn't want me to be. And they kicked me and my twin sister out when we were 16 years old. So we like basically had to raise ourselves.
Well, I'm glad you all had each other. That's a positive thing. You weren't
If
out
I
there
didn't
by-
have that one, I probably wouldn't be here. And I tell her that all the time.
Wow.
Because she gave me the strength to like not give up. Like my parents are, that's why I choose to like not have contact with them. Even if they asked it, you know, I usually would try, but it's like, I'm so much happier in my skin now than I've ever been my whole life. So I don't, you know, let what they say affect me anymore.
Right. Because it's your life. How old are you?
I'm 26 years old.
Oh, yeah. You're a grown ass man
Yeah,
now.
we just turned it. Yeah, we just turned 26 in July. So
Well, happy belated birthday to both of you. Happy belated. And I'm just so happy that you guys have each other and stick together like you always have, you know. Now, if
We
y'all start
always will.
fighting, I'm gonna have to come down there and beat both y'all's behinds and get you straightened out because, you know, we need
Well,
each
I
other.
always,
You know, we
that's
need
what I
we
tell
need
her all the
support.
time. Automatically, when we start fighting, I'm like, I'm sorry. I'm a dick. I'm sorry. It's just the hormones. It's just I rage sometimes. Like I was being mean to her when I was having surgery, like when I had surgery, just because like I was in pain, like, and I didn't mean to lash out, and I told her that. I was like, I'm sorry. Like,
Right. Well, we're
it's just
sending you
me
some
hurting.
positive energy. So let me ask you a question. When you realized you were trans, how old were you?
I knew at a very young age, like 4 or 5, because I used to walk around the house in oversized shirts and grab my dad's hat, put it on, and then my mom would look at me and go TT and point down so I could realize what it was supposedly. And I'd be like, no, pee-pee, pee-pee. And she'd be like, no. And then she'd call me by my birth name and be like, no, you have TT. And then funny story is, like, when I say this, a lot of people, you know, are not weirded out, but they're like, whoa. So in the womb, me and my sister were upside down basically, and they told my mom that it was a boy twin and a girl twin. They told them that.
Wow.
But when we were born, me and my twin sister are 2 hours apart. When we were born, Xena came out first, and then I came out. They thought, oh, it's going to be the boy twin. Well, when I was born, obviously, I was born female.
Right.
But they did think that it was a boy and girl twin. But that wasn't the case. But now it's just like, I tell my parents all the time, like, when I would talk to them, I'd be like, see, I told you I was a boy all along. Just, you know, stuff got messed up.
No, what happened was, it was revealed. It was revealed prior to this day. It was
That's what I told them.
And you had to go through something to be the strong, to be one of the strong ones in that relationship between you and your sister.
Yeah. Well, like I try to tell people all the time, like, I wasn't happy, you know, being born in a female's body, but it's also a blessing in disguise because I can also help someone that went through the same thing that I went through.
Right.
So I don't see it as a curse or anything. Like, yes, I did struggle with it for a very, very long time because I did. I struggled hard, you know, because growing up Christian the way that I was, I would pray to God that he would change me.
Right.
And, you know, because that's how I was raised. Like, I prayed and prayed, like, God change me, God change me.
Right.
And then I remember one day, it was just like, nothing else mattered. I was like, I'm okay. It's okay.
Now,
And that's what I did.
Now, someone just asked the question, and that's awesome. Someone just said, can a boy and a girl twin be identical?
Yes.
Yes, they can.
They can. We're still identical.
We're still identical. I
You've
mean,
proven the point.
we are still identical. Like, most people can, you know, tell us apart. Some people can't. Unless, you know, they don't really listen to my voice and hear us.
Yeah, but you still sound like a young dude to me.
Yeah, so I live in stupid Georgia, so they're they're closed-minded here. So, you know, of course, like I remember one time we actually were walking around where my sister used to work, which was a fresh market, and these drunk people came in there, and they were like, "Oh, are y'all twins?" At first, they're like, "Oh, are y'all a couple?" And we're like, "Are you kidding me? Like, we look alike, like we favor." And they were like, and so my twin sister, she brags about it all the time. She's like, "We're twins," and she's like, you know, they were drunk, and they were like, "So why do you have tits?" And I'm like, "Okay, some boys have man
Bamboo.
boobs, like, it's what happens, like, it's okay." And they're like, "Then why do you have hairy armpits?" And I'm like, "Because some people have hairy armpits, like, why do we have to fit these certain gender roles?
Right.
Like, fuck gender roles, what about sushi rolls? Like, why do you have to worry about?" And then next thing you know, the question comes out, "What's in your pants?" That's none of your business.
Right.
That is
Right.
my life,
Right.
and something I do not discuss with anyone unless I'm dating you.
Right.
Like that.
Right.
That is something you shouldn't say to anyone.
Right.
So of course, with being in a conservative town, as I would say, like, I'm petitioning my name right now, and they have already had to repetition my name 3 times because of they said that it didn't say Michael when it said clear as day Michael in my petition, because Gwinnett County is very conservative. When I first started hormones, the Walgreens I went to, the woman looked at me dead in the face, said, "Are you pregnant?" and then refused to give me my testosterone because she didn't agree with it.
She asked, "Were you pregnant? How the hell you gonna?" Okay, never mind.
That's what I'm saying. How the hell, like, how am I pregnant when I'm trying to get testosterone?
Well, sometimes what they do is they give testosterone to girls for birth control. They do that.
Yeah, I saw that. But then I was just like, but I'm sitting here, like, explaining to you, like, but she refused to give me my hormones. And my adopted mom actually went, like, I walked out to the car, obviously upset and, crying because that was embarrassing. She did it in front of all these people,
Wow.
And so it hurt my heart and made me really uncomfortable. And so my adopted mom walked out there, and she came back, and she was like, "Excuse me?" She was like, "I know you didn't do that to my son." And she was like, "I'm just following protocol." She was like, "No, my son told me everything you said."
Right.
Everything.
Right.
So my mom made a report to their HR people.
Okay.
And they sent me an apology and everything. So needless to say, I don't shop at Walgreens anymore because
Right.
of that reason. But now I go through my doctor my testosterone doctor I go through in Atlanta. She actually has her own pharmacy. I don't know if you've heard of it, AHF of Atlanta.
Yeah, I heard of it.
That's what I go through. It's AIDS Foundation,
Okay.
and that's what I go through.
Okay.
Patricia
Right.
Marshall, and she is phenomenal.
Okay. Awesome. 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 Well, I am so excited for you. I really am. And to see you coming forward. And this whole thing this too shall pass. It'll be nothing later on. It's just a story for you to share with someone else who may be going through some changes. And we all go through different steps on our journey. But you look awesome, young man. You really do. You look awesome.
I actually do vlogs myself, and I named it Trans Power with Landon. I always try to talk about known issues in the community, not only the trans community, but also the LGBTQ. So if you ever look on YouTube, just look up Trans Power Landon. I always try to post a video regularly, but I haven't lately, obviously, because I've been having health issues.
Right.
And I've been, dealing with, my own relationship issues. So I took a step back, and, I've been dealing with family issues. I had a family member of mine murdered.
Wow.
And so I've been, dealing with my own stuff. But I do try to help the community. I try to get them to understand, most questions that are asked.
Right.
It's just like, they ask, who do you experience the most hate from in the community? And I'm like, well, lesbians and fellow gay men, because they don't understand it. So instead of being an asshole about it, I try to educate them because I rather someone educate than be a dick. That's
Correct.
how, because I don't like confrontation. That's just who I am. So I rather educate them and bring awareness to my community and let people know, like, hey, we're not a lesbian that just wants to be a boy one day.
Right.
Because that's mainly what they think. They think, oh, we just want to be a boy one day and then we're going to switch back. No, that has nothing to do with that.
Right.
So I try to just bring up, situations that I go through, or I do a Q&As, and just, I want to help other people like me, or hell, just help anyone I can.
Right.
Even if it's by, bringing, like my last one was about mental health. I wanted people to know that mental health is real.
Right.
And that is not something that you can just bring onto the table.
Right. Right.
And
we deal with
because
that. We deal with that in our community strongly.
We do, and it hurts my heart to see it, because I just saw one of our fellow trans brothers. He actually dealt with mental illness, and he lost his battle to it last week or a couple days ago, and I can't remember his name, but it hurts my heart because I want everyone to know, like, they're not alone, and it's okay. It's gonna be okay, and it gets better, because
Right.
with my situation, growing up with my parents, in that Christian background and abusive background, like, I went through a lot of stuff growing up. So I want them to know it gets better. Like, I'm 26 years old, and I've had 6 attempts, and I'm still here. There's a reason I'm here, and I haven't had one since, because I'm stronger and I am better, and I know I am here to live my story and live my life the best I can.
And that's why you're on the Real-Nez, a reality talk show for trans brothers, for community. But we need to hear your voice like everyone else's voice. And that whole suicide thing, I've done it. We get to that point where we're just like, I give up. Love, community, living can really get to trans people. And trans
It
men,
can.
I think we just fall to the bottom when it's at that point. And I realized in time and over the years, there's a reason I'm here. And whatever I need to be a vessel, that's what I'm here for. So,
and that's what I'm trying to do.
yeah,
Is
and
be
just
a
keep
vessel,
doing
because
it.
I want to help.
Keep doing it.
I don't want anyone to ever feel alone and feel like they have no one they can talk to or no one they can be comfortable with. When I tell them all the time, I'm like, no matter what time it is, it could be 3 o'clock in the morning, it could be 4 o'clock. I work night shifts, so 4 o'clock in the morning, 5 o'clock in the morning is fine. Like, if you feel like no one's listening, like, I can relate.
Right. And that's why my phone
I might not know
Right.
some things you can talk about, but I will try my damnedest to talk to you.
Right. And that's why my phone keeps ringing up till 5 and 6 in the morning. Most of you that are on this live know that I will talk all night, every day. I will go to sleep talking to you. And it's kind of funny because sometimes I do. But it's just what we are. When we try to be there for our community, that's what we do. We try to be there.
Exactly.
So I appreciate you, Landon. I appreciate you. You hug your sister for me, and I'm going to try to come and get down there to see you all. Oh, I have a question to ask you. How do you feel about trans for trans dating, and 2 topics: trans for trans dating and pregnant trans men?
For trans and trans dating, I am a full believer. I am pansexual myself. The way that I describe it is, I'm not attracted to the parts, I'm attracted to the heart.
Yes.
That is what I look at. I'm actually attracted to trans men and women. I am. And at first it was hard for me to accept it, because, when I didn't, like, I was like, no, that's gross, because I wanted to be like everyone else. And then I was like, that's stupid, Landon. You're not like everyone else, so why do you feel like you have to fit in a box? You know what I mean? Like,
right.
So I accepted it, and I'm actually kind of sort of getting to know a fellow trans guy, and he's very, very attractive. His soul is very beautiful, and he's really attractive. Also, with trans women, I'm totally okay with that too. I am totally down with it.
Right.
It doesn't bother me. Like I said, I don't look at parts. I look at hearts.
Right.
If you identify as a woman, a feminine woman, fine, cool. I will do everything I can to make you feel comfortable.
Right.
That is fine by me. Trans men, I actually, myself, before I had a hysterectomy, I had planned to get pregnant because I wanted to be able to have kids myself of my genes. I did. But I didn't have that choice because I had polycystic ovarian syndrome. And they had to take out my reproductive organs ASAP because I had precancerous cyst.
Right.
But I did have that option. I completely, if you want to do that, cool. That's fine. Like, I feel like everyone should be able to express themselves any way they should, even if it's with pregnancy.
Right.
I just wouldn't be okay with it if they were doing something that they shouldn't, like drugs or during the pregnancy and stuff like that. Like that kind of stuff I'm not okay with.
Right. Right.
But I agree that, you know, you should, it's your body. You should be able to do what you want with it. And, you know, that comes into play, you know, with everything else, like, you know, female to male, male to female, like, you know, everybody has their thing. I know some other trans guys and other trans women don't agree with me, but I feel like, you know, if it can happen and if your body is able, I feel like you should do it if you want to. I couldn't.
Yeah.
And I couldn't even save mine because, you know, my body was so messed up. And also with hormones, you know, it made it worse.
Yeah, because honestly, I think it's a great experience because I miscarried in my early 20s. And now I'm older. I can't bear children. But, you know, if I was in my 20s, I would try to bear a child. I would like to have something from my DNA. I like to have a child.
Well, at least you're going to have a niece and a nephew.
Yeah, see, my twin sister is actually about to have kids with her wife. They're about to go through the process.
Wow.
So I'll be able to have that part. You know what I mean? I'll be able to have that part. But it's like, even if I like wanted a kid really bad, I got lucky kind of in my scenario. If I wanted a twin bad enough, my twin sister could have it for me, and it would have my genes. We're twins,
right?
So I got blessed in that part. But my goal was to have kids before it, because, you know, I did have my time, but it was a messed up kind of way. So I kind of see it as a blessing in disguise that it didn't happen the way that it happened. Because I won't go into it, but I'll talk to you about it in like a private message.
Yeah, we'll talk about it later.
When that happened, you know, I kind of saw it a blessing in disguise because I was young. I was real young.
We will talk about that later.
And so, but I do agree with it. I feel like if you haven't had your reproductive organs taken out, go for it. Do what makes you happy, and if you want to have kids, I'm totally for it. I've seen, you know, one of my friends, actually, Sebastian, he actually did give birth to a child because his partner is male to female.
Okay.
And they actually had a kid together, and that baby is fucking beautiful. He is so beautiful. That little baby is so cute.
And you know what? I think I'm going to say this. I believe that when we trans have children together, we make some pretty little babies.
Exactly.
My wife is terrified to have.
Yeah, my sister's wife's terrified to have kids.
And but my wife is 4'3".
So she,
her body really can't
hold them and take them.
And her hips.
Her hips will break if she tries to have them. So my twin sister, as most people say, you know, in a lesbian couple, you know, the dudeish one, as messed up as it sounds, the dudeish one shouldn't have the kids.
But I'm just like, you know what? What generation are we in now?
Yeah,
anybody could have a freaking child.
Amen. There you go. Doesn't matter what the body is. It's the fact that you want that child. That's awesome.
Exactly.
As long as
that baby's taken care of.
As long as I treat my kids
better than how we were treated.
Better than the way I was raised, I would be all right with that.
Positive.
And that's what we plan to do. So
That's awesome. Well, I thank you, brother, and I'm gonna hit you up later on, and we're gonna have a good conversation. I appreciate you, and I really applaud you on your top surgery. And you're gonna be all right with all this positive
I'm
energy.
gonna take care of them.
You're gonna be all right. You know, you're gonna be all right. I'm sending that positive energy of healing and comfort and joy to you because you've got a great support system right there, and that's the biggest thing. And I thank you, sister, twin sister, for being who you are in his life. I really do. I applaud you both.
I'll take
Thank you,
care of
man.
him. Thank you.
All right, brother, stay here because they might want to talk to you some more. Just stay here, okay?
I will.
That was Landon, everybody. That was Landon. Applaud Landon. Everybody applaud Landon. He's going through it. He had his top surgery. He had some complications, but he's going to be all right. He's so positive. And they allow you all to chime in and learn from us and gain knowledge from us as well. Wanted to speak and be very fair. Emily, if you want to come in, I've hit you up, come through. Emily, I know you, so we could have that conversation. Remember, this is the Transmen space. We're allowing you to come in, learn from us, acknowledge difference, acknowledge who we are. Okay, that's fine, sweetie. You don't have to come on live. Let's see who else we got here. Love. Miss Wanda, if you want to come in, come on through. Wanda is one of our great supporters of all the shows we do. And I hope that she can come in and have conversation. Remember, this is for everyone. This is for everyone to learn about the trans men community. We're opening up our space for you to come in, learn, and have conversation with us as well. If there's anyone that wants to chime in, please let us know. We're willing to have you come through. You know, I'm going straight down the line. You are next in line, straight down the line. I'm hitting everybody up. I don't care who you are. How are you doing, my sister?
I'm all right. How are you today?
I'm doing great. I'm doing great.
So what's the topic of conversation exactly?
This is our trans man space. You know, we talk about trans men. We talk about who we are, the myths, the truths, and we're exposing our stories to community. So if you have any questions, concerns, feel free to chime in on them.
Okay, about a week ago, Miko, I don't know if it was Miko or who live it was exactly, but she did a live and she had a trans man on her show. And he said that when he dates trans women, he still is concerned about getting clocked, her getting clocked, which in turn would get him clocked. And I wonder, from a trans man's point of view, when dating a trans woman or another trans man or whatever it is, how do you guys feel about being clocked?
Well, first of all, if you're comfortable with your appearance being the trans man you are, you're not going to get clocked. I mean, when I date a variety of individuals, I hardly get clocked. And I think that's because I'm comfortable with my appearance. I'm comfortable with who I am. I know where I am in my journey. And for me to be clocked, a lot of people say, well, that's rare for you, Flex. Well, maybe so, but sometimes I feel like I might, but I'm very confident with myself to know that whoever I'm with at the time, that's their journey. And I just have to be a little bit more overprotective for them than myself. I'm not scared to be clocked because I could just stand up and say, well, you know, I'm just a little short man, so what do I know? You know, it's the way you handle it as a person. I think Emily, clocked is when someone can verify the fact that you are transgender and out you. I just believe that being who I am in my journey, I'm comfortable with any trans woman, with any part of her journey that she's in. You have to have a lot of confidence, self-confidence, and strength within yourself to be willing to deal with those issues. So if you're a trans man dealing with trans women and trans men that are not, AKA, living comfortable without conflict, then you need to step back and ask yourself, are you ready for what comes in front of you?
Correct. To switch the subject slightly, not switch the subject, but to bring up another topic. It's two videos that's going around that I want to talk about. If you don't mind talking about it, it's one video with this Caucasian former trans woman who detransitioned.
I don't want to talk about it. Not today. I'm sorry. Sorry, Michaela. That's not trans man space right now.
Okay. And this other video going around. Well, this is just a warning to everybody. I know this is Transman space, but you know this is a warning to everybody. This is other video going around of a trans woman who was nearly stabbed to death by meeting somebody on an online dating site. And I was wondering, from a trans man's perspective, what is your, like? How do you date safely when you're meeting people off of dating sites or so on and so forth?
Okay, how do I date safely? First of all, I work in a group of 5. That's just what I'm. This baseball bat, dog, privacy, and observation, and getting to know somebody before they even come my direction. I'm not going to, and I think that comes from being female body, because when I was female body, I was cautious of men already. So I was already having my guard up. So my guard is always going to be up at all times. I'm not going to react, oh, somebody likes me, I'm going to meet this guy and hang out with him. No, because some men can be abusive to gay men. Some men can be abusive to men as well. So no one is safe in this world today. That's how I feel. No one is safe in this world today. So I make sure if I meet somebody on a, let's say, Grinder, I might meet them in a public space and have a conversation just to get to know where their head is at. And normally I make it known I'm not here just for the booty call. So I mean, for me, that's what I do. My guard is always up, always up, always up. I don't ever let my guard down. Don't ever let my guard down. You have to be very cautious. And I guess that comes from being female bodied, where I was always cautious when it came to men. Because I'm a little guy. I mean, you can pick me up, throw me across the room. I'm a little guy. Just a little guy. So I'm really cautious. I keep a bat in the car, a bat beside the house. I'm just very cautious. That's all it is. Right. James said it. Have to stay militant at all times. Always on defense.
Wow. That's really. I don't do personal stuff up. Thank you for letting me on.
You're welcome. Thank you for coming on. And that was my awesome. Oh, my back, my neck. Any other questions? Any other concerns? Down the line, we did Landon, Michaela. Feel free to share this as you may. Feel free to share this. You're welcome, James. Feel free to share this as you may. Remember, this is Transmen Space. We allow you all to come in and have conversation with us, to learn from us, learn more about who we are, where we're going, what we're doing, who we are in the community. This is the time for you all to come in and take time to have conversation with us and really enjoy learning from us than not knowing the truths, because we're here to combat the truths and combat the myths. So we allow you all to come on live and ask questions if you like to. We really enjoy having you all here. If there's anyone else that wants to come on, feel free. Again, this is Transman Space, where we have similar stories to share with each other. And this is a series that we do because it's for us to share our narratives. You hear much about the trans women, but let's hear more about the trans men. They say we're invisible. Well, that's because we tend to stay to ourselves. And like we said, we're very, very cautious individuals when dealing with people. And I think a lot of that comes from being female body, being raised female body. We have certain things that we may carry over to the next level. And it helps us. It helps us be more of discernment, someone said earlier. It helps us to be more, what's the word I want to say? Not visible, but to be more aware and cautious. Because the world today is not the safest place. Let's be honest, everybody. It's not the safest place. We just have to be cautious. And I think with us, we're men meeting, when we goes out there to meet other people, we meet them on a gentleman level. Anyone else have other questions or concerns? Feel free to share this. I'm still sharing as we're speaking. Adam or Landon, anyone want to get back on? I know AJ was here earlier. Jaden was here earlier. I don't know if they're still here. If you are here, you want to speak up and chime in and put a little piece of your mind in here, feel free to do so. Wow. Mark Angelo, would you like to come in and have conversation in Transmen Space and share your experience, and a little bit of your experience and your journey with some of the folks here who may never understand who trans men are? They hear a lot about trans women, their struggles and their stripes they go through, but they don't hear enough of trans men. And a lot of us don't speak up like we should nowadays because we're so busy living our lives and doing what we need to do. I will say this. There was a topic that was brought up on not too long ago. And it was a discussion about, do trans women kind of put us under the bus? And in my verbal way of saying it, yes, they do. Trans women are always so visible, so present, that they tend to forget. I don't think they forget. I think they tend to really acknowledge our presence as well as part of the community, because we're so mellow. A lot of us are just chill. You know, we're just like typical dudes, just chill. But we are part of the trans community. We're just as important as many out there. Look at that. My medication is ready. My testosterone has hit CVS. There we go. Yes, sir. I will say during my journey of transition, we were talking about testosterone earlier. We did the testosterone. I personally really had what I call growing pains because I was so thin and small. Mind you all, I'm now 145. When I started my transition, I was between 98 and 100 pounds. So I was a little skinny thing. And I was having what they call growing pains. My muscles were changing, around my skinny little legs. My muscles got bigger. And sometimes I had to lay in bed and just stretch my body just so I could get out of bed. There are some issues that we go through with transition from female to male. Because you have to remember, our bodies are created to act as a female body. The bones, all that structure. So we have to recreate the body to do what it needs to do. We have to be careful. People don't know that testosterone can cause a lot of backlash to us as well. So, I mean, it's very much like Landon was talking about thyroid issues. Now, we were just talking to Adam about high blood pressure, diabetes, blood clots, cholesterol level. We have to watch all that with trans men. I mean, it's so much. It's so much. I've tried to do the natural, Michaela, but it doesn't work for me. It just doesn't work for me. There's been times I haven't had my testosterone for maybe 6 months, but I mean, I was on testosterone for so long and my body had already evolved that I was okay without 6 months. Now, I will say this, when I first started testosterone, I missed my dosage for 3 months and my body actually did, and this is what my doctor said, it was like a heroin, it was like being a drug, it was like I was on a heroin. My body was actually reacting as if it was on a heroin. It began to shut down. I was sick all the time. I was getting chills. It was like a drug withdrawal, completely drug withdrawal. My body was going through it. I couldn't eat. I had migraines for days. I mean, it was really bad until I could get back on my hormone replacement. Now, one thing I'm going to say this is that for the trans men to get our testosterone is a very expensive journey. And when you're first starting out, the prices of testosterone is extremely, extremely high. Atom withdrawals is extremely high. To buy a bottle of testosterone the size that Adam showed earlier could run you from $240 to $300 a bottle. So not having the funds, it's costly. It can be very costly depending on where you're buying it from, who you're buying it from. That's why we run and get those discount cards before we can get some insurance. We try to find ways of paying for this. Those discount cards you can get a little bit cheaper, maybe a good $70, $60. And we're paying out of our pocket. A lot of times we're paying out of our pocket. So we keep those jobs going so we can pay for our medicine, first of all, and our wellness. And then on top of it, we've got the doctor bill to worry about, so we've got to pay that. And that's why it takes us so much longer to get our top surgery, because we're trying to live every day, because in order to get the top surgery, it's expensive. I remember when top surgery, and I know Mark Angelo was on here, top surgery back in the day could run you $3,500. Now, top surgery can run you from $5,000 to $10,000 for top surgery. Mine ran me $8,500 for reconstructive top surgery. That's what I had. It was not just a mastectomy, it was reconstructive top surgery. So when as you all see here, when my scars start to heal up, naturally, I will look as though I'm naturally pecked as a man. I mean, I already had, my pecs were already able to be used for my top surgery. So any trans men out there, if you're in the gym, work your pecs up if you're gonna have top surgery, because it makes it easier for the surgeon to do your surgery. Yeah, Adam, the prices are ridiculous. And, that's why many of us don't have our top surgeries immediately, because we don't have the medications. We don't have the insurance. We don't have the funding we're trying to pay every day. And coming from female to male, transitioning, remember our jobs, we got paid cheap jobs, and some of us had to go back to school to get the training to have a better job when we become men, because we're working to pay for our surgeries and our medication and our doctor's appointments. It's very expensive, so very much expensive. And we know we just can't stop our medicine, because that testosterone withdrawal is no joke. It can even cause you to end up having your menstrual cycle, because it cuts off all of that right there. Our man caves, which people call vaginas, our man caves, they're like prunes now, because we're not using them. They actually tighten up. Not to be funny, but I've been intimate with some gay men, and they have said to me that I use my frontal. Yes, I do. They said they don't mind, because it's like having a tight ass. And I was like, well, that explains why the boys are chasing the trans boys. Go figure. So to be honest with you, we go through so much, but we still have to be medically involved with our medical care, because we are born female body. We still have to have breast exams. We still have to have pap smears. I'm 50-something years old. I just had a colonoscopy. They went in there and checked my whole colon and all that kind of stuff. We still have to do all the medical care that's needed for the body. We can't stop doing that. The pap smears are very much important to make sure you don't have cervical cancer. The breast exams and all that, very important that you don't have breasts. If you haven't had top surgery, you need to keep getting checked. Keep getting checked, because when I didn't have top surgery, I had several scares, and I was getting these lumps underneath my fold and in my chest, and we were scared that it was cancerous, and come to find out it was just tissue just clotting up. So I was just thankful that I was getting my top surgery, because it was a scare. I kept getting scares every year, and it was just crazy. Doctors were scared I had cancer. I was scared, well, if I don't get top surgery, they're going to cut them off anyway. And I was just thinking that way. So we have to very much take care of your body always, always. Trans women have to do too. I tell trans women, get your prostate looked at. You could have prostate cancer. So no matter what body you're born in, we still have to take care of our bodies by having regular checkups and taking care of those parts of the bodies that we still have. Because we can become ill if we don't. And I will tell everybody, every hole must be checked. Your ear, your mouth, your nose, your eyes, even downstairs. So that's something a lot of people don't realize. And I'm very much of an advocate for my trans men to have their medical checkups at all times. Please have your medical checkups. It's just amazing what how our bodies evolved from where they were to where they are now. What you see here was nothing of what I looked at. And I will post on my page sometime this week a picture of me as a child, a picture of me as a baby, a picture of me as an adult, and a picture of me as now. And many of you might say, oh my God, you really don't look the same. I don't. So for those of you that like to, that are coming in, we are sharing Transman space with Transman stories, and trans men are welcome to come in and share their story to those who have questions, because this is the time that we defeat the myths with the truths, because we are always hidden away from who we are, and we're so invisible that when we become visible, people believe that we're just some new, like we're an alien. Because you're like, I'm a trans man. Oh my God, you're a trans man. I know a lot of trans girls, and that has nothing to do with me. In my mind, I'm like, their transition has nothing to do with me. So you can't look at me going through transition as the same way a trans woman goes through her transition, because they're two different journeys, two different genders, and two different people. Now, my trans man brothers, we might have similar paths, but how we go about it is going to be different. And that's the same way with trans women. They might have similar paths as each other, as their sister, but it'll be a different journey. So I want you all to understand that that's what we're here for, to educate the masses and give them a little bit more awareness and share our stories as well. So we are here for that, and that's what we're here for. Right, Landon, to each of their own. Let's see. I think it's funny because a lot of the girls, trans women, they see us and they call us adorable and cute. I guess we are. I guess we are. Remember, you all can ask as many questions as you want here. This is Transmen Space. We invite you to come in, friends, family, community to come in. This is the time where we share ourselves with community, with questions and answers, and our stories, a bit of our stories. You just met Landon. He had his top surgery, and he had some complications, but he talked about who he is in the community. Adam was here as well, and so we're just inviting whoever wants to come on through. If there are any lesbians that have questions or someone who's considering to transition or just wants to ask questions, feel free to come through if you have questions. We're here for that as well. Again, we're here to defeat the myths and tell the truth. Hello there, young man.
Hey, how you doing?
How are you doing today?
I'm cool. I'm cool. What's been going on?
Not much. We just shared a little bit of ourselves to the world so they know that we're not as invisible as they think we are. This is our time to have time
Right.
conversation based around trans man issues, trans man stories, ourselves. This is not a space for the trans girls, but this is a space for them to come and learn as well as society about who we are.
Yeah, I can dig it.
What are you doing?
Um, I was kind of putting away my vape stuff. Yeah.
So how long have you been in transition, Fabian?
Whew, like, what about 4 years?
Okay.
Like, as far as hormone therapy.
Okay.
I realized I was trans when I was about 21, 22. I started talking about when I was 19 though.
Okay. Okay. Okay.
That, every- everybody has their journey and like, hey, what's up, Adam? It's like, you worry about what people might think and what your family might do or how they might react and all that. So that's what took me as long as it did to actually start.
I think that's with a lot of us. We're trying to prepare our families with the journey. And sometimes as a man of color, how is that journey for you?
Oh, well, it's been kind of mind blowing to see to see the difference of how you interact with it. Oh, whoa. Hold on 1 second. See the difference in interaction with like different people as far as being a man of color versus identifying as, even though I never felt like a girl, but being biologically female to being biologically male, pretty much, it's a big difference how people interact with you. It's crazy. Like I could be sitting at a park bench and pre-transition, older white woman would sit next to me and we could have a full conversation. But like now, like I
She
can
not
sit
gonna sit
down.
next to you. She ain't gonna
Oh
sit next
hell
to
no!
you. She gonna walk right past you and sit next to somebody
Yep.
else. She gonna look at you like this.
Yeah, that's crazy though. It's like you can tell, you can feel and see the stereotypes that they put on black men.
So let me ask you this question because I go through this too. So we're gonna share this. Because me being a man of color, I find that
Hmm.
I don't go out at night. You've been to my house, so you know the story. I don't go out at
Yeah.
night because I fear for my life as a man of color. I really do. I fear for my life as a man of color because I know the dangers that we face and the stereotypes that they put on us at nighttime. So I tend to
Yeah.
are you
Like
that way as
perception.
well?
Oh yeah, even before transition, like I was walking with a group of my homeboys and got stopped by some cops and we're like, "What's the problem?" And they're like, "Oh, 'cause you just look like somebody we're looking for." Like stopped us, ID'd us, and everything. We had done nothing but got out the car to walk into the house with a pizza.
Wow. So you stole a pizza?
No, I'm just probably gonna confiscate it for evidence. Yeah.
Wow.
Yeah,
Wow.
it's
So
pretty. It's crazy.
how does your family take your transition?
Well, one thing the therapist I saw uh, made me instill in myself, like even though they could be sounding ignorant and everything, if they're actually going through transition with us, they've gone through a whole lifetime knowing us as one way, one person, and all of that. And then you just pop up like, oh, I'm a man.
Right,
It's like,
right,
I mean, but the crazy part about it is like these are the same people that know you. You know what I'm
right.
saying? Like they know your characteristics. They see who you are. And like my mom, like even when I was a kid, I was like 11, 12 years old. She'd be like, "You like guys, right?" I'm like, in the back of my head, I was like, I say, "Yeah." In the back of my head, I'm like, "Yeah, as friends." It's like to me, as a kid, me talking to a guy that felt like gay to me, and I have no
Yeah,
problem with my community, but as far as I identify, I'm not attracted to men. I never have been.
right, right. I understand. I got it. There's a bug in my house. But yeah, little gnats flying around and whatnot. But I mean, that's the same thing I was going through, and that's why I asked that question. Um, you know, I want to make it clear that, and I want to bring Adam and them on too, because sometimes we deal with more as men of color in society regarding privilege, and that's something I want to bring
hmm
them in as well, because a lot of people say, well, you're trans, you don't have privilege. Well, I'm a
Yeah,
black man
speaking of
now.
privilege though,
Yeah,
speaking of privilege, like people that they say you're passing or whatever when you're passing. Um, as far as privilege with male privilege in the workplace, I saw that drastically too.
right.
It's a lot of favoritism. Like the boss is he wants to be your homeboy. He's gonna put you over this girl over here.
Yeah. Oh yeah.
That's crazy.
I saw that a lot on my job as well. I got a lot of favoritism as an elder man of color.
hmm
As an elder man of color. And I was like, wow, really?
Yeah, it's so drastic. So like things that we've been used to and ways we've been treated or not considered in certain things,
Right.
especially like younger. When I was younger, I did a lot of construction work, and I've always been burly and husky and strong. So
Right.
I just really surprised them when I could keep up or do much better than everybody then. But now it's just like, oh yeah, here you go, you got this.
Right.
Yeah. Before they question like, are you sure you can lift this? Like hell yeah, I can lift it.
Right. Right.
So like personally, I don't feel like it's even right to discriminate against women without knowing what they're capable of, especially if they're applying for a certain job. They obviously know what they're doing. You know what I mean?
Right.
As far as the workplace, I feel like you should be treated equally.
Yeah, because I noticed my pay went up. Some priorities. If I said, well, my wife is sick, I had the day off. I mean, it's amazing some of the priorities we got as men. Now, that's the one thing I realized. Now, I will say this though. I got privilege on the job site, but also when I was female bodied, I had some privileges that I could never receive as a man of color. Do you understand
Yeah,
where I'm coming from?
yeah,
And I wonder if a lot of the Caucasian guys went through that as well as women on their job site. So, I mean, these are small questions. So let me ask you a question. Do you date? That's I'm gonna ask that question. Do you date?
yes.
Are you pansexual, bisexual? What are you? I can't call you. Look, I can't call you lesbian because that ain't gonna work.
I'm hetero.
Okay, cool, cool. How do you feel about T for T relationships?
Oh, I have no problem with that. Actually, like I feel more comfortable. Something. I mean, it really. To me, it's no different. So, woman's a woman, a man's a man. You know?
Right.
It's like
Okay.
they. It's like they all women think alike. I've dated trans women. I've dated cis women. They
Right.
all do this. I mean, I'm not saying they're all the same. So, ladies, don't bash me right now. I'm saying they
Right.
think alike though.
Right.
They have that femininity to them.
Right. Do you have anything you want to add before we bring someone else on, or a little bit of your life story or anything?
Mm, I'll just chime in, ask some questions myself. It's good to sit here, talk to you, and share views and different experiences with everybody.
It looks like you're getting older looking to me. You look a little older today.
Oh,
Um, yeah, that's happening. I
mhm.
see. Yeah.
It already came up. Like I'm thinking I'm gonna have a Sanford like you. I was talking too much shit. That's
Yeah,
what I get.
you
God
gonna
said,
get a,
"Whoop, there you
and
go."
that's another thing people don't realize. We do get a receding hairline with testosterone.
Oh yeah.
Mine was not a receding hairline. People don't understand. I
Yep.
didn't lose my hair because of testosterone. I cut my hair for a cleansing process because I'm Buddhist, and I did a cleansing.
Mhm.
And everybody said I kept looking sexy. Oh, you look sexy with a bald head. And I kept shaving it, and I kept shaving it. And then when I decided to let it grow back, my follicles said, I'm not letting you do any hair in your head. So I just stay bald now. That's but they say it looks sexy, so I'm just gonna keep
No
trying to
kiss
be
you.
sexy.
You got to round my bald head. You know what I mean? Like Whopper style. You know I got a joke with you.
Carlita said she wanted to ask how everyone feels about trans relationships. Carlita, we have no problem with trans relationships. Like
No, not.
like many of us have said before, that trans relationships, we don't look at the gender, we look at the spirit or the heart of a person.
There's understanding there and support.
Yeah, because for me, a trans relationship, I think we have a lot in common because we both have a struggle, we have a journey, and we can be a little more supportive to each other if we are a match, because sometimes it's not a good match. We can be supportive to each other's journey because we know what each other's
Mhm.
going through. Because trans women, they're emotional wrecks. Because I used to be emotional when I was female body. Now I'm not that much emotional. I'm the opposite of what a trans woman
More
would be.
aggressive.
Right. Well, I'm not aggressive. I'm just more laid back.
I mean, like I know, like a lot of guys I talk to when they first start T, like they do get a little aggressive while they're, like right after the shot.
But I don't think it's the tea.
Strong.
I got my personal opinion. I don't think it's the tea. I think it's the personality of a person. Because I think people say, well, I wasn't aggressive when I transitioned. I was really mellow anyway. I was real laid back. So I think a lot of that depends on the individual. I don't think it has to do with the testosterone or transitioning. I think a lot of it has to do with the person itself.
Yeah, I feel that. It's like they're going through mood swings and PMS and too. So
Right, right.
take that away, but that's what I can. I've been through it, pre. So I understand and I know what I see.
Right.
Especially, I noticed after trans women, they just take their hormones. They're like, they could be very, very emotional. I know a couple of them even said, like, they even started crying out of nowhere.
Well, that's what women do. Cisgender women do that. When we had no testosterone in our bodies, we would cry, oh, why me? And we would act a fool. And everybody would look at us and say, well, suck it up. And we're like, oh, we would cry like fools. But now, when somebody starts crying, we're like, suck it up. We tell everybody
Suck it
else,
up.
suck it up. Get over it. You're going to be all right. I remember
Yeah.
I remember when I didn't lose all that. I have my emotions, but I lost
Mhm.
that craziness when my ex's son was crying one day, and I looked at him and I said, "Why are you crying?" I used to be like, "Oh, come here, baby, it's okay." I was like, "Why are you crying?" I
You
said,
caught
"Boy,
yourself.
yeah." I was like, "Look, wiggle your feet, wiggle your toes, shake your head. You all right? Now keep it moving."
That's funny.
I think being when I was female body, I was a mess. I think I was really a mess. I was really a mess. I was so imbalanced. I was a mess. I think I had bipolarism and didn't know I had it. I was just
Hmm.
pure messy. Um, I just know that the testosterone settled me out. It kind of
Yeah,
mellowed.
it leveled you. Yeah, yeah. I
I
mean,
think that's what,
a lot of times, like you have a high T count anyway.
right, right.
So
So I think that's what happened with me.
the estrogen that going back and forth and battling each other is just could be sometime.
Right. I think that's what happened with me. It just kind of dwindled a little bit, kind of mellowed out a little bit, and kept it going
Yeah,
forward. I think that's what happened.
or yeah,
And I,
I think I can say the same.
I think that's what happened. But the boy in me got really strong. The boy in me really was like, all right, football time, baseball, and I'm not the TV man. I like baseball. That's it. And I love being in the presence of cisgendered men when they're talking about sports. And I don't even like sports like they do. So I sit there, I'm like, yeah, yeah, yeah. And they're like, yo, man, you watch football? I was like, no, I'm a baseball man. Don't nobody talk about baseball. Somebody talk about baseball. Oh, you like baseball?
No,
Man,
no,
you don't like no
it's
football? Man, I like
majority know
lacrosse.
basketball, football for real.
I'm like, I like lacrosse.
Hey, lacrosse is contact too. I think that's what it is. People like to see like folks interact, especially like tackling all that, trying to fight to get the ball down the line, defense, offense, all that. That's exciting, especially when you got a couple good teams going.
Yeah, yeah. I will say this. I don't think nobody knows this, but when we take our testosterone, and I'm gonna break it down. When we take our testosterone, we get aroused over a chocolate bar. We ain't gotta look at nobody in a skirt. We ain't gotta look at your
Always like,
face. We could walk. We could go in the store and get excited over a damn chocolate bar. We get
seriously
aroused over
thinking
a
about it.
chocolate bar.
It's, it's a constant thought, like sometimes too. Especially when you have a partner that's like egging it on, like damn it.
I'm like, why am I sitting up here looking at the chocolate bar? This don't make no sense. It don't
That
make no
chocolate
sense.
looks good.
Yeah, be looking, and then when you taste it, you're having an orgasm, and you're like, oh, sucky.
No, but like I know when I'm hungry though, I see that, I smell that food. I tell you that first bite, I'm like, like right
Look,
where
when I
I
go
need
in
to
the
be.
store, it's funny. It's like when I go in the store, I see a Hershey's bar with nuts in it. I'm like, oh yeah. Get in the car. I can't help but to throw myself into it.
That's gone 2.5 seconds up.
It be gone. I'm like, woo, yeah, there we go, party time.
And then when it's gone, it's like, damn, I should have got another one.
Yeah. Sometimes I'm like, it's crazy. It is truly crazy. And that's why people don't
Man.
understand. We like the trans women, they talk about, well, I don't get aroused. I said, well, girl, we do.
Yeah, no,
I'm
I've heard
always
that like
ready.
there's it goes down.
Well, think about it. We came from female body. Were we really excited all the time?
Not like that, no.
Right.
No.
So they just got the reverse of what we went through. Happy for them.
Yeah, I got a pretty healthy sex drive, I could say.
I do too. It's healthy. It's a healthy.
Word,
A healthy.
I can dig it. It's a
So,
healthy.
let me ask you this question: Do you
Yeah,
so do you deal with trans women or cisgender women?
both.
Do you practice safe sex?
Oh yeah,
I always
have
gotta ask
to.
that question.
Yeah, have to. You have to. You gotta protect yourself. If you love yourself, you're gonna make sure you good.
Okay. And do you now I'm about to put it out there because here's my plug. Do you are you on prep right now? Because you are you know what I'm saying, on prep. HIV prep.
I I'm not on prep, but I'm not even like that sexually active right now either.
Okay, but you do
I'm
get
talking to somebody, but I don't. I'm not. She's not a piece of me. You know what I'm saying? So, but
right.
we
So
do practice. We do practice safe sex though.
so you regularly get yourself checked and everything like that for HIV,
Oh yeah.
STD too. Yes,
Yeah, every 6 months, even if I'm not sexually active.
that's a good thing. See, that's what I want people to know that we are taking care of our bodies. We are taking care of our bodies, and that's what we have to do. We have to do that.
Yeah, got you. That's very important. You know, anything can happen from that to walking across the street. And at least
Right,
when you walk across the street, you're gonna look both ways.
right. There you go. Go ahead and look one way if you want to. You're gonna get hit.
Man, real truth
No,
though.
I really thank you for coming on, and I appreciate you a
Thank you
lot.
for having me. I
So stay
appreciate
on
you.
here,
Thank you.
share this live. We do this every Monday. So share the word. Tell the guys it's time for them to jump on the love train and jump on here and do their thing on this live. It's every Monday we will be doing this at this time. And I want them to come in
Okay.
and share their stories and their narratives. I thank you very much,
All right.
Fabian. We love you. Stay real, man.
For real, you too, sir.
All right, everybody. That was Fabian.